Good afternoon, and thank you for the opportunity to speak to you all this afternoon. My name is Bernie Riley. I'm the General Manager of Prostate Cancer Foundation's Telenursing Service. And this afternoon, I'm going to speak to you about bridging the gap with the Prostate Cancer Specialist Telenursing Service. So Prostate Cancer Foundation Australia, as you know, took hundreds and hundreds of calls each year from men and families across Australia looking for support and information about prostate cancer and prostate cancer treatments. These calls traditionally were answered by administrative staff and volunteers who, while they were trained that they could listen and they had some understanding of prostate cancer, they didn't have that clinical knowledge there that a nurse or a doctor or someone in your treating team might have. And so PCFA recognised that this was a gap in its service and set about developing a telenursing service, a nursing service to address these needs. And we also realised there was certainly some gaps there in terms of PCFA supports around approaching 100 prostate cancer specialist nurses across Australia. And Australia's a massive country, and there's thousands of men newly diagnosed each year. So with the burden of disease and the geography of Australia, there was no possible way that we could have a nurse in every corner of the country, in every health service, in every hospital. And so there was a great need for another option where men and their families could get support, information and education about their options for prostate cancer and the problems that they're facing. Along with that comes the major mental health or men's health challenges, and they're quite significant. A significant proportion of men don't understand the signs or symptoms of prostate cancer. They don't know when or how to get a PSA test. They don't understand the PSA testing guidelines. They don't know enough about diseases and treatments. You can see there 2/3 of men have unmet information needs. They just don't understand what the treatment involves, what prostate cancer is, what the prostate is, and the side effects of the treatment. And you can imagine men who face a diagnosis of prostate cancer and go through cancer processes and treatments have significant anxiety and depression, and 1 in 5 men develop that over their lifetime. And with every new diagnosis, men in the first year after that diagnosis, 70% of them have an increased risk of suicide. So you can see the major challenges there that we face, and so PCFA thought about addressing those major challenges and those major issues, and the first step in that, or one of the first steps in that, is the formation of a telenursing service to address some of those concerns. And so how did PCFA go about it? They embarked on a mission to address those gaps, and over a period of 18 months, they disseminated all of the calls and the themes of the calls that came into the inquiries line each day, and engaged University of Technology Sydney to help us develop a service, understand what might be needed in a service, and develop a resource guide to help some nurses inform and educate patients or people as they called in. And so UTS adopted a particular methodology, the co-design methodology, which is about pairing with consumers and people as well as using research to inform what might be necessary if you're going to develop a service like this. So they took focus groups of men and their partners and survivors, people from support groups and clinicians across Australia, and got their opinions and information, and asked them a range of questions about what would be needed in a service for prostate cancer and for people affected by prostate cancer. They did a literature review of similar telenursing and telehealth lines that are out there across the world. And then we set about also going out and scoping other services which are similar to what we were looking to set up. And we had discussions with Cancer Council and Prostate Cancer UK, the Melanoma Institute and the Lung Foundation, and we thank them for their contribution to helping us set up our telenursing service. And of course, these services don't appear out of nowhere. We certainly had to raise some money to make this possible, and we couldn't thank the Australian public enough for the generous donations and the support of organisations like Dry July, which really enabled us to launch this program and get us set up to do what we need to do. So the plan was that and a little bit more, and obviously we needed to know what we needed to do to set up a service. We needed to get the right staffing structure, the right infrastructure to do what we needed to do. We needed to be able to handle the calls successfully and manage those and capture some of that information, so we knew where people were coming from. We understood what their needs were, and we were able to keep track of that. We had to develop policies and procedures and guidelines. And the main thing we had to do, one of the main things we had to do was to develop a resource which we as nurses could use to answer those calls. And that was that collaborative process between our nursing service and UTS, gathering all that information and putting it together in a meaningful way. And so we had those discussions and over a number of months put together a resource guide, an electronic resource guide, which helps us inform all of our calls. During that process, we were lucky enough that there was an ongoing review of Prostate Cancer Foundation Australia resources and booklets, and UTS were also collaborating with the nursing service for the ongoing sort of professional development and learning needs of nurses, not only at the sites, but for our future nurses as well. And so we were lucky enough to be able to use some of those resources, and they're the bedrock and platform for that information that we relay to people who call us or email us each day. So on March 22 this year, we were able to launch our nursing service, and we've made steady progress and had quite a few hundred calls from different people across all facets of Australia. And I guess, you know, what do we do? So when you call 1-800-220099, or you email telenurse@pcfa.org.au, you'll be connected with a prostate cancer specialist nurse who can provide you with consistent and evidence-based information and resources about all aspects of prostate cancer. We can try and help you understand your diagnosis, what your pathology means, what the treatment options are for you, and the ways in which you may be able to manage some of those side effects of those treatments. And we try to provide some support around making that decision. We don't make that decision for you. We don't try and sway you in a particular way when you're trying to make that decision, that initial decision of, do I go down the surgical route or the radiotherapy route, or do I have hormone therapy, or do I do nothing, or do I do active surveillance? We don't make that decision for you, but we provide you with all the information and support you might need to make that decision. We also offer relevant practical and emotional support, practical support around dealing with the particular issues that may come up day to day when you go through a treatment of prostate cancer, or when you're concerned about something. We can give you particular information about any number of matters and side effects, and obviously emotional support, a listening ear, listening to what your problem may be, and sometimes that may be all people need, just to be heard and just to be listened to. They may not need a solution, but if you need a solution, then we can help you find the best way to find that solution. And obviously a big part of what we do also is trying to link you with local support. So we work together with our prostate cancer support groups around Australia and our locally based prostate cancer specialist nurses, and also our other arms of our support wing. So the online community, which is growing and growing, and our Mates Connect program. So we try and connect people with somebody who's been through a similar experience, a volunteer who can help support you through what you're going through, or can help you make that decision. So we're trying to link you with all of those avenues. And obviously, also we try and link you back in with your treating teams and GPs to get you that best support. And quite often that might be where you turn to get the right information. It might be another discussion with your treating team about what's going on, but armed with, more information and more education about what's going on, so that you know the questions that you might need to ask. So each person, as we go through their call, we listen to what their problem may be, and we talk about those issues, and we try and get a gauge on how much this is distressing you as you call in. And that distress level helps us discern what the problem may be and the significance of that problem to you. And then we work through each of those problems, any of those concerns, and we try and offer that practical solutions for some of those problems. We can signpost you appropriately back to appropriate mechanisms of support and care, whether that be your treating team, whether that be something like a pelvic floor physiotherapist, or a continence nurse, or a sexual health physician, or a dietitian, or an exercise professional. So signposting appropriately to some of those other referral points that may be necessary across the way. And obviously we suggest that there may be a need for you to be referred and for greater intervention. And sometimes with that high level or that extreme level of distress, there may be further assessment with your GP, with your treating team, and further on it may be counsellors or psychologists that may be required to help you get through what you're getting through. And obviously with any level of distress, whether you're sort of moderate through to that extreme level, we follow you up. Obviously at your discretion, but we like to keep in contact with you and make sure that you're tracking along okay, that we try and reassess where you're at, address the needs that may be there, and put in place some interventions, linking you with support where you need it, further information, and something locally that can help you out. So what have we noticed so far since we've been taking calls? Well, with the gaps that were identified earlier in men's health, well, that's certainly ringing true in the callers that have called us thus far. 20, you can see almost 25% there are identifying high to extreme distress when they call us. People who are newly diagnosed, people who are faced with cancer recurrence, people who are dealing with significant side effects of their treatments. So there are significant issues out there that are being faced by people. And almost 70% of people, 2/3 of people, have a moderate to extreme distress, and that goes across all of our callers. So whether it's a man who's been newly diagnosed, someone who's concerned about a diagnosis of prostate cancer, a wife, a daughter, a partner, a daughter-in-law, all those people calling us. There's various levels of distress, and certainly significant distress out there in the community. And so we look to follow this tiered model of care, of psychosocial care for prostate cancer, and refer people on appropriately to the interventions that may be required or may be helpful in dealing with these particular issues. And so what are some of these issues? In the first 3 months, we just took a little bit of a look at what are the most distressing things, and for people who rated their distress in that moderate to highly distressed category, it was the uncertainty about their future, the information they needed about their illness, and understanding their treatments, and worrying about their treatment, that there were the most prevalent things in those that was causing that high level of distress. And for those who reported sort of mild distress, it was, again, understanding your treatments, and that can be understanding what treatment is available to you or how to get that treatment. And obviously urinary issues, an ongoing issue, and that goes, for all levels of just distress, but that was one of the most prevalent, and I guess that's can be a long-term factor, and so I guess it's unsurprising to see that come up as something where you might rate that as mild over time. It continues to ebb and flow over time. At times it might be high, and at times it might be a little bit lower, depending on where you are in that cycle of things. So how do you connect with the telenursing service? So I mentioned before, the easiest way to get in contact with us is through our main switch line, 1800 22 0099, and asking to speak to a nurse. And either that, or you can email telenurse@pcfa.org.au. On the main web page, you go to the support link and look for Prostate Cancer Telenursing Service, and there's an online inquiry, a web inquiry form, where you can submit your details and request a callback at a particular day or time that you might like to be called back. If you need the services of an interpreter, then you can certainly go through the translation and interpreting service through the federal government links there, and as you would for most services, we're very happy to speak to anybody either who needs an interpreter or who has some hearing or speech impairment and might need to use the National Relay Service. We're available sort of Monday to Friday, 9 to 5. On the Wednesdays, we do open until 8 p.m. So there's a nurse on the line until 8 p.m. to answer calls. And certainly, obviously, being a growing service, we're growing our staff as well. There are times when we certainly are busy, and we do encourage you to take the option to leave a voicemail and just leave us a message saying when you'd like us to call back, and leave us your details, and we get back to you as soon as we can. And that's usually almost always within 24 hours, 24 business hours anyway, obviously not being open on the weekend. This is our lovely team here. Amy, who is one of our specialists with a background in radiation, nursing and palliative care. Tori here, who's our nurse based in Melbourne, who has a strong focus in urology background, surgical nursing and continence nursing. Sally here is our Director of Nursing. And Kathy is the voice behind the phone when you ring. Kathy and Kelly, our administration staff and reception staff, do a fantastic job of taking some of those calls and listening to people and addressing some of those concerns, and then forwarding on to us. And we couldn't do it without all of that magnificent team there. So obviously, we've gone a long way there, and we're a little bit pressed for time. So thank you for the opportunity to speak to you today. Obviously, there's a little bit of time for, I think, one question, and I can see that one has come through. How do I go about contacting my local prostate cancer specialist nurse? Okay, so the best way to contact a prostate cancer specialist nurse is, again, you can go to PCFA's website and go to the support link and look for prostate cancer specialist nurse, and you can click on the link to find a prostate cancer specialist nurse at a location near you. And obviously, as I said, there's around about 86 now, heading towards 100 the end of this year, end of next year. Alternatively, you can call 1-800-220099, speak to Kathy and Kelly, and they can put you through to our telenursing service, and we can help answer some of those questions, but we can also make that link for you to that locally based nurse. I hope that helps. Thank you again for your time. Please do reach out if there is anything at all that you're concerned about. We're happy to talk to anybody about any particular problem, any concern. We really would encourage you to reach out. We realise that it's not easy. We're really nice people, and we'll try and do our best to make what may be a terrible situation for you, or a difficult situation for you, the best we can. So thank you. I hope you enjoy the rest of the day and enjoy the rest of the presentations. I know it's been a great conversation thus far, and I hope you enjoy the rest of the day. Thank you very much.